I have these dark circle, discoloration, hyperpigmentation. I don't know what it is, but it's underneath my eyes and it's really becoming a problem. About 3 years ago, I started noticing a little discoloration, and then gradually it started getting worse and worse and started changing color, and it started veering off to the edge of my eye. It just seems to keep growing. This is actually a good day because it's not hot. The sun seems to irritate it and have it flare up. I've been asked many times, is she sick? You must be on that Hollywood diet and you're not eating. I had somebody ask me if I was being abused. It affects me a lot on set because cameras now being high def, they see everything. I'm worrying about my character and if I know my lines. The director will be like, can you touch her up with some makeup? And then they can't figure it out. I lose out on roles and they don't hire me again because if I'm taking up time, that's costing them money. If I lost my makeup, I would cry. Not even boyfriends have seen me without makeup. I wear makeup to bed, I wear makeup to the gym, I wear makeup to go hiking. Doctors have told me that this is hereditary, but there is not one person on either side of my family that has this discoloration. I am worried that this could be something more serious.
We sent Athena to board-certified dermatologist Dr. Batra for a full workup and consultation.
When did it all start? You said about 3 years ago. Did you start a new medication?
I started Adderall for borderline ADD. And for the first 3 or 4 months it helped, but then I guess like with any other drug, once your body gets used to it, it wants more. And that scared me because I've heard so many horror stories about Adderall and people getting addicted. And
do you still take the Adderall now and then, or do you?
Every now and then, because I've been on birth control and I thought that's what it was, so I got off of it for 2 months.
Sure,
but that didn't go away.
In Athena's case, it could be something as simple as atypical melasma, which is just a pigment issue.
I've had a lot of indigestion and acid reflux. I always feel fatigued.
But talking to her and finding out all the other kind of weird symptoms, there might be something more there. The range of things that can cause this type of discoloration in the worst case scenario is an autoimmune condition. I think that we should just do a couple tests. Maybe we need to dig a little deeper. The biopsy is really just to make sure there's nothing autoimmune going on. The other thing is any sort of a drug reaction. There are other things that can be going on in the body, especially in a case like this, so we don't want to leave any stone unturned.
Please welcome Athena and dermatologist Dr. Sonia Batra back to the show.
Dr. Batra, so what did you find?
We did do the blood test, the full test, to see if there were anything autoimmune or more chronic, and the really wonderful news is there wasn't.
Oh, great.
So your blood test came back completely fine. So that was great. But interestingly, what the biopsy really showed was something called a photoallergic dermatitis, which was actually related to the medication you were taking. So I think what was happening is you were taking the Adderall, and then you'd go out in the sun, and there's actually a UV reaction plus the drug, which causes this very specific allergic reaction that then was leading to the redness and to the inflammation. But then ultimately, in someone like me or like you who has more pigmented skin, sometimes the footprints and the marks left by the inflammation are actually worse than the rash itself. So you have this post-inflammatory hyperpigmentation or discoloration that actually gives you that look that you've been swollen and beat up.
So then is there anything that can be done for the after effects, this post-inflammatory changes on her face?
So the first step is obviously to get rid of the medication, so just stop it completely because that allergic reaction plus the light is what's causing this. And then pretty much from now on, whenever you're out in the sun, please wear a broad spectrum UV sunscreen that's going to block both the UVA and as well as UVB because we know that plays a huge role in this particular allergy. And then the second thing we'll do is we'll give you an anti-inflammatory cream just to calm down whatever's left of that reaction because as you come off the medication, this should get better no matter what. And then finally, I think part of it is you were being treated for melasma and you were using these irritating products that were meant to fade things out. But while the allergy is going on, that's actually going to be really irritating and make it worse. So first we'll get the inflammation settled down and I'll get you on the correct anti-inflammatory cream. And then once we've settled everything, I'm happy to do the peels complimentary in my office to get rid of the